right. I think we are ready and recording. So, Becky, it is such a pleasure to have you here today. Everyone, it's Karen Holly back from KH Essentials and Menopause Life. And I'm really excited about the type of speaker we have today because not only do Becky and I have three things in common: foreign languages, supporting breast cancer, and traveling. Um, she is also a huge women's health care advocate. Not only is she a doctor, OBGYN, but she's a NAM certified OBGYN. And you guys have heard me talk about in the past why for perimenopause and menopause, it's critical to have a NAM certified doctor on your side or on your team, because just because someone's an OBGYN doesn't mean they understand the depths of the things that you may or may not be experiencing. So, Becky, without further ado, I want to introduce you. So, Dr. Becky
Okay.
Lynn, how are you today?
I'm good. I'm having a wonderful day. It's been just busy. It'll be over before I know it.
Okay, great. Well, we're so happy to have you here. And Becky, I thought we could start with, I know you did your undergrad at Georgetown and you're an adjunct professor at St. Louis in Missouri. And what I love is that you actually are the CEO and founder of Evora Women's Health. So, can you tell us a little bit about your story and how you got started in women's health
Sure.
and creating the Evora Clinic?
Yeah. So, I've been an OBGYN now since 2003, and I began to specialize in sexual problems in women and menopause, probably like early, mid 2000s maybe. And before I started Evora, I was at St. Louis University, which I love dearly, a wonderful place. I'm still an adjunct professor there. But I noticed that I really didn't have time to spend with my patients. And that's not just St. Louis University, that's the way it is everywhere. Most physicians nowadays are employed, and your employer is, fills your schedule. And I just felt like a 15-minute visit was not nearly enough to address all the important health issues that go along with menopause and go along with sexual health. And so I decided to leave SLU, they call it SLU, and I opened up Evora Women's Health in February of 2020. So as you can imagine, right as the pandemic was hitting. But I've never been happier because I spend so much time with my patients. I can cover everything that I want to cover and everything that the patient wants to cover. And so, it's not a rushed visit in and out. I have time to go over the risks, benefits of hormone therapy or whatever we're doing. And I have time to discuss just basic prevention, health strategies to stay healthy.
Oh my gosh, that's music to my ears, as I'm sure every single one of my listeners. There was a doctor I interviewed earlier this year who also was talking about how most women only get 15 minutes with their
Yeah.
OB. So, how can that serve anyone going,
Nope.
especially a woman going through perimenopause or menopause?
Nobody. Because by the time you say, hey, how are you? How are your kids? That's like, 3 minutes there. And then part of that is the exam. It's just not enough time.
Right, right. So you
Yeah.
must be so happy now with your private practice with Evora.
Yeah. And I feel like I'm really helping my patients comprehensively. So, yes.
Incredible. And you all, besides Becky being an incredible women's health advocate and doctor, she also has her MBA. So she's
Yes.
got this forward front um, attitude towards really changing healthcare. And so that is one of the reasons I wanted to bring her on today, is because it's people like Dr. Lynn that are really setting this new stage to get women's healthcare first of all talked about
Right.
um, in the broader, United States in context of NAMs and different forums, but also just being that example. So she's a Renaissance woman in terms of opening up her own clinic, saying, you know what, establishment, this is not good enough for me. It's not good enough for my clients. People deserve more time. So yay for you and yay for all of us and the examples you're setting. So thank you.
Thank you.
Um, so everyone, I know a lot of people submitted questions for today. So besides Dr. Lynn being, she can talk about anything related to perimenopause, menopause, and she also provides preventative holistic practices. But the topic we talked about sharing with everyone today is really around sexual health.
Mm-hmm.
And how do we, as women, as we're aging, go about making sure we understand all the ins and outs of our own sexual health? So um, let's start with the first question that came in, which is, um, are there things women can do to proactively or preventatively practice, whether it's nutrition or vitamins or self-pleasuring or pelvic
Mm-hmm.
fitness? I know that's a really broad topic, which is why I picked it first. Like, what are some of those things that you think women should know
About sexual health?
Yeah, yeah.
Yeah. Okay. So I think that's really important because one of the issues that I have is we don't talk about it enough. Like women don't know what's coming, especially in the perimenopause and the menopause. So I think we do in the United States a poor job of educating women on, the changes that they're going to go through. We do a fair job around puberty, but we don't really focus on teaching women's health or educating women about the perimenopause and menopause. And then, we're kind of a culture that, oh, you shouldn't talk about sex. Women shouldn't like sex. It makes people embarrassed. It makes providers embarrassed talking about it. But sex is so important to your overall well-being and your relationship and your happiness. So, part of what I really believe in is, letting people know that you can talk about women liking sex. It doesn't make you, trashy or a slut. No, like it's part of life. And, sometimes I say, it's food, shelter, and sex, right? That's what we're about. So why do we have to be so hush hush about it? So I think one of the biggest issues I see in my practice is women are unaware of the changes that are happening. And so they feel broken because no one's talking about it. So they're like, what's wrong with me? I must be the only person with this issue. They don't know who to talk to. They don't know who to turn to. I've had, several patients come in and say, I didn't know there was a doctor who treated sexual problems in women. Like, why would they know that? I get that. So I think part of what I do is, educate about the changes that happen. And when you think about sex in relation to menopause, a lot of the sexual changes that we see have to do with the loss of hormones. So the loss of hormones not only causes hot flashes and night sweats and weight gain and bone issues, but it really affects your sex life in two ways mostly. So one is the loss of estrogen and testosterone affects vaginal health. So premenopausally, the vagina is thick and it's moist, it self-lubricates and it stretches. It has elasticity. When you lose those hormones, the vagina doesn't stretch anymore, it doesn't lubricate like it used to, and that can cause painful sex. And the issue with that is those changes tend to show up about 5 years after your last menstrual period. So not all women are aware that it's due to the loss of hormones around menopause. Most women know hot flashes has to do with when your periods stop. But women go around going, oh my gosh, what's wrong with me? And their partner says, why aren't you lubricating? Do you not love me anymore? And they feel horrible. So, one thing you can do preemptively is use low dose vaginal hormones to maintain your vaginal health. You don't have to wait until sex is painful. And the thing with low dose vaginal hormones is that they don't carry the same risks as systemic hormones. So they don't increase your risk of blood clot, breast cancer, heart attack, or stroke. So you can really safely use them. Also, using low-dose vaginal hormones maintains a healthy pH to prevent yeast infections and BV, and using low-dose vaginal estrogen helps prevent recurrent bladder infections. The other thing, sorry, I could talk forever.
No, keep going,
Yeah.
because I know where I'll jump in, and this is exactly what women need to hear. So keep going.
Yeah. So the other thing I was going to say is that as women age, our testosterone levels go down. So women have testosterone. In fact, we have more testosterone than we have estrogen. We just don't have as much testosterone as men. And so our libido goes down. And testosterone starts to go down in women in your early 30s. And so this becomes an issue in many relationships, not in all relationships, where women just aren't as interested, not wanting to have sex. And it becomes sort of a desire discrepancy where, and I'm being very heteronormative. I know not all couples are man and woman, but men tend to have higher sex drive because of the higher levels of testosterone. So there becomes this mismatch, which can be really destructive to relationships.
Oh my gosh, such a wonderful, wonderful mouthful, Becky. I love, love, love. Let's talk about the estrogen first. Bringing up the low dose. And what was interesting with a girlfriend of mine, and you and I know that I also believe in it too. And it definitely is non harmful for cancer concerns, right? As an ovarian cancer survivor, I would never do something to my body that put my body at risk of some
Right.
sort of cancer again. And while I had to wait a year before I went on that low dose, what was interesting is some women are using too much and they're like, oh, it's so messy. And I'm like, no, you only need like a tiny, tiny bit of low dose cream if you're using a cream, right?
Yeah.
And that can have a huge impact on the elasticity and the moisture and just everything else you mentioned. But they don't, I think some people think that it's like the old fashioned, remember when we had yeast infections and you had I
Like
can't
an
even remember the name of the brand.
applicator.
Yeah, and you would fill the whole applicator with cream.
Oh, right.
Back in the 80s and 90s when all that, but now there's tiny little pills. But I
Yes.
think women are correlating to that, right? Because that's our generation that grew up with that.
Right.
You don't need that much of the low estrogen cream, right?
Right. You don't. You definitely don't fill up that entire applicator. And I also wanted to add that there are other products that are not nearly as messy as the creams. So I think the creams work really well, but there's two other products. There's Invexi, which is a little gel cap. That's the brand name. It's just estradiol. It's really not messy at all. And there's no applicator. So you can just pop it in the vagina with your finger. You can do it day or night. It doesn't have to be at night. And I think it works really well. And then there's also Intrarosa, which is a suppository. And that one actually is more than just estrogen. It gets converted to estrogen and testosterone in the vagina. And the vagina has testosterone receptors. So the Bartholin's glands, which make lubrication, respond to testosterone. That one has an applicator, but it's not a cream, and the applicator is disposable. And so like with the cream, sometimes it's really hard to get the cream out of the applicator. It's really messy. I tell my patients if they like the creams to put the applicator in the dishwasher, if their family members are okay with that, because that gets the cream out of the applicator. So yeah.
Right. I've got little special brushes that I use, and I use hot.
Good idea.
But I also, just because it's so little, I've just gotten to the habit of just putting a little on my finger and using my finger to insert it. But I'm super happy you brought up Invexi and Interosa, because I met with the CEO of Interosa, I think a year ago, when I was doing the in-person panels as a potential sponsor, because those products are great, and I don't think a lot of women know about them, right? And they've got NAM certified OBs like you in their life.
Yeah. And they need to know about them. They absolutely need to know about them. And I think, this sort of brings up the fact that I think, like you mentioned, seeing a NAM certified provider guarantees that they know about hormones, because I don't fault every OB for not being as up to date as I am on hormones, because I'm not as up to date on, I don't know, MIG surgery or, whatever they're up to date on. So, not everybody can be up to date on every topic within OBGYN. So I would say that NAM certified providers and anybody who's part of ISWISH, I don't know if you're aware of ISWISH, the International Society for the Study of Women's Sexual Health, is very aware of the benefits of Intrarosa.
Yes. Yeah, I had Heather Howard, Dr. Heather Howard.
I know Heather Howard. Yep.
So anyway, ISWISH is a great source as well. And for people listening, they have a website as well, and there's lots of information available. So let's, God, Becky, you are such a plethora of information. So fantastic on preventative in the hormone space. What about supplements or nutrition? Anything that you advise your clients on the more natural side of it?
Yeah.
even
So,
the hormones we just mentioned are
mhm,
not risky, if
right.
someone said, hey, in addition to that, I also want to like change up my nutrition or some
Mhm.
supplements, what do you say?
Yeah. So I'm not a huge fan of supplements. There are some supplements that women need, calcium and vitamin D, to keep their bones strong, especially when they lose their estrogen, because estrogen is sort of it definitely it keeps your bones strong, and you don't want to develop osteoporosis or osteopenia where you have fractures in your vertebrae and then you're hunched over. So it's really important to, especially the supplement vitamin D, because it is, most people are low on vitamin D. Vitamin D we get from sun, and of course we tell you don't really be out in the sun because that causes skin cancer and whatnot. And some people do get enough calcium in their diet, but it's easy to not get enough calcium in your diet. So those are really the main supplements. Beyond that, if you eat healthy and you eat unprocessed food and the right amount of carbs, proteins, fats, fruits, and vegetables, you don't have to get those vitamins and minerals in a pill. So, apart from calcium and vitamin D, I don't think there's a specific supplement as long as you're eating healthy. And I think eating healthy and with good, portion control and being a healthy weight is something that's really, really important. So one thing that happens at menopause, as far as being a healthy weight, is as you go through menopause, as you lose your hormones, you become more insulin resistant. Your body has to pump out more insulin to get glucose into the cells, which can lead to weight gain. And then when you gain weight, you become more insulin resistant, which leads to weight gain. And it's sort of this vicious cycle. Just losing weight can improve your insulin resistance. Exercise can improve your insulin resistance. So I'm a huge believer in eating healthy and exercise, which, it's much easier to just say, I'm just going to take some pills and be healthy. But no, you have to put a little work into it.
Right.
So good nutrition, exercise is really important. When it comes to exercise, there's sort of three facets that I think are important to menopausal women. One is strength training. So, strength. So, as you age, you lose muscle. And that can lead to, as you get older, can lead to falls, unsteadiness. That's probably, many years down the line. But also, as you lose muscle and you become a higher percentage fat, your metabolism slows down, which leads to weight gain. And I haven't mentioned all the negative things that go along with being overweight and obese, but obesity increases your risk for breast cancer and uterine cancer. And I haven't even mentioned like heart disease and diabetes and hypertension and strokes and all that stuff. But being obese increases your risk for breast cancer. And I feel like a lot of women don't know that. So as you go through menopause, as far as like the three pillars of exercise, one is strength training. So in my practice, we have personal trainers and dietitians that our patients see to help them create a plan of healthy eating that's sustainable. We're not a fad diet crazy place. I don't believe in those snake oil, that snake
Right.
oil. And then our personal trainers will help them build strength. The other thing that's important, the second facet to exercise, is cardio, to maintain cardiac health, to keep your heart healthy. It also helps prevent diabetes, helps burn calories so you don't gain weight. And it's good for your brain. Like exercise actually helps stave off Alzheimer's and Parkinson's. And, loss of cognitive function happens at menopause. People have short-term memory loss. So exercise is like cardiovascular exercise is important too. The last pillar of exercise, sorry, like I said, I can talk forever, is flexibility and core strength. So I'm a huge proponent of yoga. We offer yoga through my practice, and actually it's virtual. So anybody all over the United States can sign up. It's on my website. And it's really geared towards menopausal women to maintain flexibility, to help build core strength, and just overall strength in general to help prevent those falls down the line.
I love that COVID has made everyone have more remoteness, right? Because
Yeah,
even though I'm
yeah,
in San Francisco and you're in Missouri, it's okay, in St. Louis, it's okay.
yeah.
But you know what? That circles back right back into the sexual health, because when someone feels good and is in a
Right.
good mood, besides the Alzheimer, right? We all know exercise also improves your mood because of the increased
Yes.
oxytocin and dopamine.
Absolutely.
So if it comes back into the sexual health, having that healthy diet and healthy
Yes.
regime is going to help you feel better about yourself, which also I would imagine would play into sexual, a better sexual.
Yep,
Um,
absolutely. So aerobic exercise has been shown scientifically in both men and women to improve libido. So there's that. And then the second thing is body image, how you feel about yourself. If you feel overweight and down and depressed, you're not going to want to share your body with anybody else. So exercise keeps you feeling good about your body, and then you're more likely to be sexually active and enjoy it.
Awesome. Okay, I'm going to try and fit two more questions in here. One, I'm going to go to the end because it's a very specific question that a woman asked. And I know with different pelvic floor specialists, and you and I have talked about how America is slowly getting into providing the appropriate pelvic health, rehab and physical therapy and putting that on the forefront for women.
Mhm.
But different pelvic health specialists have different opinions. So she basically writes, there are mixed messages regarding the egg and weighted balls as it pertains to healthy options for exercising our pelvic and vaginal muscles. Do you
Mhm.
have a perspective on like keeping those muscles healthy and those fatty type items that maybe they're not even
Yeah,
fatty? I don't want to offend anyone, but they're out in the
right,
market.
right.
People say, "Hey, I've got my jade egg," and other
Yeah.
people say, "Balls." What is your thought on that?
I don't really recommend like the jade eggs and everything. I don't think women have to do that. I'm a huge believer in pelvic floor physical therapy, and a pelvic floor physical therapist can teach you how to do the right exercises to keep your pelvic floor strong. Definitely. So, but I'm not a big proponent of the jade eggs. And I know there's so much, one thing I think it's so hard for women who aren't physicians or practitioners to know when you look on the internet what's good information and what's not good information. And there's a lot of marketing hype around these things, but no, there's not good data to say that every woman needs a jade egg and needs to put it in the vagina and hold there. I think a good pelvic floor physical therapist can teach you how to maintain a strong pelvic floor.
Well,
Yeah.
I'm glad you said that because I've interviewed a couple pelvic floor specialists, and I
Mm-hmm.
and I have a dear friend she's become a dear friend since,
Mm-hmm.
and she said, yeah, you just they don't do that, and I had to go through pelvic floor rehab after my
Mm-hmm.
surgery, and
Yeah.
she taught us how to do the right kind of Kegels, and
Yeah.
she teaches you how to use devices and tools and/or your own finger, and just
Mm-hmm.
really use your breathing. So I'm grateful for your perspective on that. Thank you.
Yeah. And one other thing I was going to say about that. What I was going to say is that you can end up with a hypertonic pelvic floor where your muscles are so tense that they forget how to relax. So, yeah, I'm not a big fan of the eggs.
And that was actually what happened to me. So
Mhm.
after my ovarian surgery, I told you this, my right
Yeah.
obturator nerve
Yeah.
was impacted, and what they attributed it to is down on the right side of my pelvic floor, those muscles had gotten so tight, rock hard
Mhm.
after the surgery, trying to
Yeah.
protect that part of my body,
Yeah.
that it wasn't about teaching me how to save off incontinence because
Right.
of the surgery. It was literally they had to go through months of relaxing that muscle.
Yep.
So and then
Mhm.
teaching the muscles to retighten and relax, retighten and relax.
Right.
So
Mhm.
again, another amazing point that I think women forget. They think, oh, I want everything tight. And the
Right.
reality is you want the control over
Yep.
having something tight and loose so that you can have the control in that region.
Mhm. Absolutely.
Okay, let's see if we can get one more in. I
Okay.
love this one, which is really interesting. It was, how do you define sexual health as we age?
Ooh, that's a good one. How do I define sexual health? I define sexual health as being able to partake in sexual activity. It doesn't have to be penetration. I think we always think of penetration in a way that's pleasurable to you, fits your lifestyle, and makes you happy.
I love that. Yeah, and there's so many different ways to do it, right? And
Yeah.
making you happy is the is the important.
Right, right. And I think, we all have this idea of how sex is supposed to be. And I just wish we could get rid of that. because it doesn't have to be. In fact, I think it's not like it is in the movies. You know, the movies, like if you, this is one of my biggest pet peeves. So when you see couples in the movies, they're making love, they both come at the same time with penetration, and then it's over. And I feel like that's a little man-centric in a way, because 70% of women cannot orgasm from penetration alone. You know, the woman's most sensitive spot is the clitoris. And many times it's turn taking. One partner goes, the other partner goes. And if you're so fortunate that you always come together for penetration, you're few and far between. And so I don't know how I got off on that tangent, but yeah.
That's perfect. I mean, we
Yeah.
want this open conversation that's just so easy, right? Because women don't want to feel alone.
Right.
And that, what you just mentioned about the movies, or God forbid porn, or right, that is just not reality. And even the mental aspect that you brought in earlier, right? Women, because we're multitaskers all day long, it's hard for us to unwind. And if a woman is given that opportunity to be focused on, right, when you said taking turns, there might be more likelihood that she has an amazing orgasm. So for women not to compare themselves to the movies and know what's for them and their partner is a good thing. And
absolutely. And that's an important point for men too, I think, because just like women think about sex one way, like in the movies, so do men. And then, you know, I've heard from my patients, you know, a woman will say, oh, well, or the man will think that he's not a good lover because he can't get her to do what he saw in the movies. Like, no, no, that's not how it works. So we need to teach men as well as teach women.
Right. And teach ourselves, right? I've interviewed a couple of women who are sexual health experts, or they call them, they're not doctors like you, but they have gone down that path of teaching women how to talk to their partners, teaching women how to touch themselves, to understand what they like and what they don't like, teaching women how to understand their own bodies so that they can be a good teacher to their partners.
Yes.
So I think that's important. What I want to end, or I want to kind of start closing out, Becky, on something else that you mentioned that kind of came in a question, which is women don't want to feel alone, right? So you talked about vaginal dryness. We talked about, and I'm going to focus more on the sexual part, the libido. But what are some common issues that you see with your clients that women could experience that they all of a sudden feel like they're defective or broken, like you said? What are some of those other things, so that when women hear this, they go, oh my God, that's normal, I'm not alone.
Yeah, I would
some of those again.
So definitely libido and dryness and painful sex, but also orgasm. So when you lose those hormones, I always feel like estrogen is the gas that you have to have in the car before the car will go. And so orgasm, some women, when they go through menopause, they lose their ability to reach orgasm, or it takes so long and it's so much work. And when it happens, they're like, wasn't that great? And they have no idea that that happens when you lose your estrogen, and they feel horrible and broken, or their partner feels bad that, you know I'm saying I realize not every couple is he and she, but he's like, oh, what's wrong with me? I can't get her to reach orgasm. And it causes some huge problems. Now, granted, like the women that I see are coming to me with an issue. So there's probably a lot of women out there who just deal with it and, make adjustments to make things work. But yeah, no, orgasm changes, and women can lose their ability to reach orgasm, or it can become much more difficult.
Wow, thank you. So I hope everyone out there was listening with wide open ears today. What an amazing time. And I know we definitely are going to have you back, Dr. Lynn.
Yay, I'll come back anytime.
Yeah, you can talk about so much. I know we need to keep it within a certain time frame for folks, but I'm so grateful for everything that you've brought to the table. So grateful for your casual conversation and how open you are. And for anyone who's interested, even though Becky is in Missouri, like she said, a lot of their services can be accessed, and it's Evora. Is it Evora.com?
Yeah, it's EvoraWomen.com.
EvoraWomen.com. Okay.
Yeah.
Right.
And the other thing, one thing that we do is we have eHealth, which is, and some people will do this just one-on-one with me. Other people will get together like a group of women who just want to ask questions. And then we can definitely do that via, the video chat, and I can, make it a fun ladies' night out, however they want to do it, and answer questions for women. Because like I said, I really want to make sure women know these things.
Thank you so much. And also it's important, right? I think one of your messages when you and I were speaking earlier is you want women to feel comfortable, even speaking, like if they have their own doctor now, they need to be forward with what they're not getting, or find a damn certified OBGYN, or
Right.
find someone on their team
Right.
that really has that extra perimenopause, menopause focus.
Yes. Yeah. And if it's sexual health, ISWISH too is a great, you can, plug in wherever you live and find an ISWISH provider.
Right. Right. And thank you for reminding me about that. I'll put that in the tag when we launch the video. But thank you so much for your time today. Always a pleasure. And I hope your day goes easier for the rest of the day.
Yeah. No, I'm good now.
All right. We'll see you soon. Thank you so much.
All right. Thank you.